All right. Well, in the interest of time, let's start our program spotlight. And like I said, this is DESC's program spotlight focused on our crisis response services. Specifically, we're going to be focusing on our mobile response division. And we're very excited today to have Freyton Castillo, our director of the mobile response division, and Daniel Malone, our executive director, here to talk more about that. I'm Brianni Ball. I am the Fund Development Director, and I'll be just a facilitator today, asking questions, watching the chat. Many of you sent in great questions already, and we'll get to those at the end. But first, we want to start off with a video that highlights our mobile response division in about 4 minutes, and then we'll come back for the conversation part. So I'll ask my colleague Shannon to switch over to that, and we'll get going.
Thank you for calling Crisis Response Dispatch. This is Noelle.
Hi, this is Officer Martinez calling from SPD.
The last few years have brought about a lot of change in the community and society, and more of the people we're trying to help are struggling. External support has diminished quite a lot. At the same moment that we've needed more of it because those systems are overwhelmed. And so we determined we needed to come up with some of our own versions of the ability to help ourselves. So we've created some specialty kinds of crisis response.
DESC is a leader in the community when it comes to serving the most vulnerable population. We provide unique and innovative services for clients experiencing really intense and unique crisis situations.
What we are responsible for there at Dispatch is receiving phone calls from the county, all of King County, from different law enforcement departments, fire departments, Crisis Connections 988, designated crisis responders, as well as some of our permanent supportive housing facilities, and then try and get that referral to the right team so they can help with stabilization efforts.
If somebody has a need and they're in crisis, we do respond. How we respond and what we provide really varies greatly. We're often interacting with people at some of their darkest moments in life. Sometimes people just need that friendly ear to listen. Other people, they may have more acute or high-risk needs. We do our best with what's available to try to match people up to the services that are going to hopefully best meet their need.
Our new programs within the Mobile Response Division provide a wide array of services rooted in crisis response.
The Crisis Solutions Center is where first responders find help for individuals in crisis. The Crisis Diversion Facility is where people in a behavioral crisis can stabilize. Crisis Diversion Interim Services provides extended support for people following immediate behavioral crisis stabilization. The Mobile Crisis Team is dispatched to meet people in crisis in King County. Homeless Outreach Stabilization and Transition provides street outreach and case management for people experiencing homelessness and living with an untreated serious mental illness. The Behavioral Health Response Team provides before and after crisis support to help prevent repeated crisis events. The Mobile Response Team provides crisis services for permanent supportive housing and emergency housing residents. The Crisis Response Team rides along with the Seattle Police Department to de-escalate crisis situations.
We want to give people a fair shot at being successful in their life. We want to be able to help folks navigate through those issues and those problems that people might be going through and do so in a manner that really directly involves them.
Where we were doing an outreach for a referral that we received, and one of the staff people we were talking to actually reported they were getting a little emotional. They were kind of flashing back and memory was coming back to when our mobile crisis team outreached them some years ago in King County and actually connected them directly with the Crisis Solutions Center. That interaction actually was very instrumental in them getting their lives turned around. DESC is able to touch segments of the population that other parts of the system struggle with.
Thank you for watching that quick video about our mobile response division. We will send that out along with the follow-up for this. So if you missed part of it, you can watch it on your own. And you can also, we actually encourage you to share that out in your communities as you see fit. So like I said a little bit earlier, I'm Brianni Ball, and I am the Fund Development Director here at DESC. We're excited to be hosting this virtual program spotlight so that we can reach out to more communities and raise awareness around our mobile response division and our crisis response services here, which have expanded quite a bit in the last few years. But first, I want to make sure that we acknowledge the land that we're on. So I'd like to ask you to join me in listening to our land acknowledgement. And our actions go beyond just the words here. And so we are always committed to undoing the harm. So DESC occupies the indigenous land of Coast Salish peoples. We ask you to join us in acknowledging their community, their elders, both past and present, as well as future generations. DESC also acknowledges that many indigenous peoples from near and far were dislocated from their lands and cultural practices, resulting in many hardships, including homelessness. We honor all Coast Salish and other indigenous peoples and commit to learning and identifying DESC's role in undoing harm. So thank you for that. And as most of you, I'm guessing most of you know, DESC helps people with complex needs of homelessness, substance use disorders, and serious mental illness. We help them achieve their highest potential for health and well-being through comprehensive services, treatment, and housing. And we're really excited today to talk about the people who deserve a system that can appropriately care for them, and how we're working to make sure that everyone has access to such a system. So like I said, we have Freyton Castillo, our Director of the Mobile Response Division, and Daniel Malone, our Executive Director, here today to talk through why we have this crisis response system, what in the history of our county has made this necessary, what's changed a bit, what we're looking forward to helping co-create in the future, and what services we offer right now. So I will get started and ask Freyton, I'll ask you the first question to answer. And as we can see from the video, DESC has been busy enhancing the community's crisis response system. But let's start from the beginning, because crisis can mean different things to different people. So how does DESC define crisis?
Hey everybody, Freyton Castillo here, he, him pronouns, like Brandon saying, I'm the Director of Mobile Response. When we're defining crisis, it can boil down to a time of intense difficulty, trouble, or danger that someone's experiencing. It could be a really intense situation. Oftentimes when someone is in a crisis situation, we're seeing someone in the worst day or having the worst day of their life. And the thing about crisis is that it can be overarching. There's not one set definition. And it can affect anybody. It can affect me, anyone on this call, one of our family members, and it's something that can occur in our lives. And the person next to us could be experiencing a crisis, and it's really important for us to gear our services to treating and serving that person in a crisis with the most humanity and respect that they can. Just to kind of dive into a little bit more about like what a crisis could be and like kind of what it could look like. It could look like someone not being able to get out of bed for the past 2 to 3 days and not responding to people that are their support systems that they care about the most. It could be someone experiencing paranoia where they hear voices or people talking about their family, through the radio or to the TV or just, walking on the street. Someone that's not able to take care of themselves or their basic needs due to a substance use disorder. Someone that has passed out on the sidewalk or walking into traffic, feeling like they want to end their life. Someone that could, another example is someone that's unhoused, living in a tent, that has been assaulted, for the 4th or 5th time that week, and really struggling with that. Someone that's living paycheck to paycheck and not having the food or money to pay for things that their family and they might need, and that could lead to overarching depressive symptoms that could result in suicidal ideation, and wanting to end their life and things like that. So there's a lot of different things that can encompass what a crisis could be, and again, how we gear our services for the folks that we are serving is really to address those situations and do so with as much dignity and respect as possible.
Great, thank you, Frayton, for that. That's super helpful. Daniel, I understand that DESC led the charge to highlight the inadequacies in the crisis response systems a few years ago. So can you tell me more about how DESC did this and what's been done since then?
Yeah, thanks. I really appreciate everybody joining us today. So the slide you have here describes a system of crisis response that is a framework that is being used nationally. This isn't something we came up with, but it's a really simple concept that I think helps to understand what different elements of a well-functioning system would be. And essentially it boils down to these three things. If a person's in crisis, sometimes they just need someone to talk to. And that can be handled often over the telephone or via text or other means like that. Some situations require somebody to respond, somebody to go where the person is in the community and address them directly and try to help them in a more face-to-face and direct way. And then finally, sometimes situations are at a point where the person actually needs a place to go to help recover from that crisis. So that's the basic framework of a community crisis response system that can deal with the various kinds of situations that come up with. DESC is a key provider of services in the second and third elements of that system. So the first element of somebody to talk to is largely covered by the crisis line that exists in our community and has for a long time. It's operated by a local nonprofit called Community or Crisis Connections, and they deal with a high volume of phone calls of people in crisis and people calling about people in crisis. The two parts that DESC has long had a role in include the part about having somebody to respond to folks. Our mobile crisis team has been in place for more than 10 years, and this is a group of mental health professionals who go out in pairs 24/7 anywhere in King County to help address the needs of any person who is in crisis. And then we also have had for more than 10 years a facility that people can go to, the Crisis Solutions Center, that is a short-term stabilization facility where people can get rest, eat something, see a nurse and psychiatric provider, start to work on things that will help them both recover from the immediate crisis and help stabilize them so they won't go back into crisis later. And so that is something DESC has been involved in for a long time. What we have had to do recently is really expand on those efforts because the situation has needed more than we've had in place to be able to deal with. And a lot of that came down to the experience that was exacerbated by the pandemic, where we were seeing more people having more crisis events in general, and more of those crisis events being of a more severe nature. And so as we were having those experiences, we also recognized that the support we used to rely on had really diminished significantly, support from other elements of the system. And that included sometimes invoking the involuntary treatment system, the involuntary psychiatric treatment system, sometimes utilizing the support of law enforcement to help with different kinds of situations that we were encountering in our various DESC programs. And basically, a lot of the help we used to rely on was not coming, or at least it wasn't coming in a timely way to provide us with more relief that we needed at that specific moment. And so as this continued, we began to speak more with our colleagues in other behavioral health organizations, other social service agencies, and then ultimately with our local government partners about the state of things being really dire, where there were more of these events, they were more severe, and less help was available than it had been before. And so we began to request more support from our local officials to help make sure that things could get restored or brought into a better way of doing things. So one example I'll provide to you is that there was a situation where I happened to get directly involved. I'm not normally in our program spaces and dealing with those kinds of situations on a daily basis or in a direct way. But one day I happened to be supporting one of our programs because we were short-staffed and some additional help was needed. And when I got to this supportive housing program, there was an incident that occurred where one of the tenants was struggling and had done some deliberate property damage that resulted in a huge water event. Water was flooding out from a deliberately broken pipe and was causing all kinds of havoc in the building, below the apartment where it happened and in the adjoining apartments. It was a really big problem. And as I began to learn a little bit more about the situation, I learned from the other staff on site there that there had been an ongoing issue with this particular tenant where we had been trying to get additional external help. And it had been recognized that this person was in a pretty serious psychiatric crisis and met criteria for involuntary hospitalization. And we'd been working to get that in place. But unlike in the past, when those kinds of interventions could be relied upon to happen relatively quickly, like the day it was needed, in more recent times, those interventions to get somebody who's not safe to be in the community into the hospital do not happen in a timely way. They're very often weeks and weeks away from being able to happen. And so recognizing this is what was going on in that situation, our staff had been attempting to make this happen for many weeks. I did some follow-up then and contacted the folks in our community who handle the involuntary treatment determinations, and ended up speaking on the phone with a person I know in that office and she confirmed for me that yes, this was a situation that they had awareness of, this particular individual, and it was on their list to get to, but it was still going to be some time before the person was going to be hospitalized. And one of the responses I got from this colleague was, basically this. She said, "Daniel, I'm just really sorry." And what she was conveying to me there was an acknowledgement that these situations are really difficult, and the system itself is rather broken and not able to deal with really significant issues in a timely way. And then the other thing she said was, "Daniel, I don't know how your staff do it," which itself was a recognition that, for example, in our supportive housing programs, staff are having to hold up situations that they wouldn't have been expected to have to hold up in the past. Somebody who is in such a severe psychiatric crisis, they're not safe to be in the community, but they're remaining in that state for weeks on end, and our staff are having to manage as best they can in that. And so that was really instructive to me, that it was more widely recognized in our field that the system was not up to what was needed for all these kinds of situations. So DESC and some other organizations in the community called on local elected officials and other key government folks like the Seattle Police Chief and the King County Sheriff and others to come together to understand better what the state of things was, and so we could talk about some solutions. And we put out the call to all these important officials to come together for this, and to their credit, in my view, they all showed up and they listened to us and other behavioral health providers describe what was going on, and they listened to our recommendations, and some of that began to produce some new resources. One thing that ultimately happened from those meetings, which were happening in the latter part of 2021, was laying the groundwork for what became the King County Crisis Care Centers levy, which was approved by the voters in King County this past April, and is going to produce some new interventions for people in crisis. It's going to take a while before that stuff is in place. Those meetings also produce some other resources that would allow DESC in particular to expand crisis response and create some new forms of crisis response to make sure that we had at least something in place that could substitute for what we used to rely on, which would have been, say, getting support from the police to intervene, or getting support from the involuntary psychiatric treatment system to intervene. So those were some really important changes that have come about. So I'm going to turn back to Freyton to tell us a little bit more about what some of those changes have been, the things that we've been able to build into the system to allow us to have a better and more comprehensive response to different kinds of crisis situations.
Thank you, Daniel. So like Daniel was saying, and kind of what we've been talking about, again, crisis is very complicated, and there's a lot of different nuances to that, and come with that comes the need for various programs that address crisis in different moments and different stages of the crisis continuum. One of the teams that was stood up as a result of this advocacy that Daniel was mentioning was the mobile response team. One of the things that we were seeing with folks in permanent supportive housing and shelter sites was, there's crisis that happens in those situations. When someone gets placed into a housing site, crisis doesn't just poof, it's gone. There are different things that are still in play, and there's transitions, and it's a new environment. And so, we wanted to, one of the services that we provided with the mobile response team was to really hone in on addressing crisis in those settings, to support folks in housing sites and shelter sites so they can maintain those placements and be successful in those environments. What was happening is, people were waiting longer for assistance, and there wasn't, the attention on folks in those settings was kind of getting lumped in with the rest of the crisis system, which can cause delays. And so, with what this team does is they go into someone's home environment, and they address that, and they are able to meet with the person, build rapport, and get to know them, and try to figure out how can we help. What are some things and some solutions that we can put into play here that can help to ease the situation and ease the tension, and again help folks stay and remain successful in those housing settings, which was going to ultimately cause long-term success for someone, where they can continue to build on their recovery and engage in their recovery. So that was really important work for us, to be able to address crisis for folks in those settings, to help people maintain that. With that being said, there was also a component that we wanted to incorporate where, after that crisis was over, we're able to utilize case managers and peer specialists, which are folks with lived experience, to help maintain that stability beyond that initial crisis episode. So being able to work with somebody for up to 90 days to really solidify that success and solidify that stabilization for again, to help people stabilize further beyond a one and done type of service. Another resource that we built up and strengthened is called our behavioral health response team, which helps to serve folks that are not necessarily in imminent crisis, so someone that might not be wanting to imminently harm themselves or others, or walking the traffic with the intent to hurt themselves, but there are folks that are in the community that are struggling with long-term issues and long-term problems that they're facing on a daily basis. This team with the behavioral health response team is aimed to serve those folks that are experiencing chronic crisis situations in the community, because at the end of the day, we want to disrupt that cycle of a crisis, so that someone can achieve stability and success with their daily life. So this team is designed to go and outreach folks without first responders, without an added presence there that could affect how someone is utilizing services, and helps folks get really well rooted into their community. This team works on folks. Works on mental health needs, substance use needs, getting connected with benefits, and establishing any type of safety net within that community, and getting that person really rooted in their community, so that they can have additional resources available to them. The behavioral health response team is again really rooted in helping folks pre and post crisis, so not in that imminent crisis situation, to really get at the other ends of the crisis spectrum. And one of the other things that came as a result of this advocacy was our mobile crisis team, which, like Daniel said, has been in existence for over 10 years, and this is a team that responds and outreaches to folks throughout all of King County that are experiencing that imminent crisis, when someone is feeling like they want to end their life or hurt themselves, or feeling hopeless, or experiencing really intense psychotic symptoms where they're hearing voices that are telling them to hurt themselves. This team goes out and they go in and address those situations and those types of crises in the moment. They go into that person's environment to provide help and support. it was recognized that there was a need for more of that, and so that team was also expanded. And so, all that to say, with the services that we provide within the mobile response division, it's, we have a slew of programs that are rooted in imminent response, where we can provide someone that immediate support, whether it's someone to talk to, helping get their basic needs met, and in the form of getting that person some food, or helping them to find a place where they can sleep for the night, which is really important in the moment, and helping to de-escalate the crisis situation, with that immediate response comes, the immediate need. The limitation there is it's a one and done type of service. Once that crisis situation is addressed and resolved, it's kind of like, what's next? So with the expanded efforts of what we've been wanting to build and what we have built, is being able to address other aspects of crisis that gives us more time. So with the case management portion of the mobile response team or the behavioral health response team, or serving folks in after that crisis situation has occurred, be able to provide that extended support so that we can maintain that success. And so really trying to get both the in the moment and how do we continue with the success beyond that peak of crisis. And like Daniel was saying, this has helped to kind of paint a picture of what the future could look like with the passing of the crisis care levy, and like what that looks like and how to expand the service even further. The need is out there. The need for services like to address crisis situations is pertinent. It's out there. It's affecting our community. And like I was saying earlier, crisis can affect anybody in our community. So it's really an important thing to that we believe that something to invest in, and it strengthens our community overall when we're able to serve folks that are needing that support, and providing them with services that treat them with dignity, respect, and give them a chance for success, in their daily life.
Thank you, Frayton. That's a lot that your teams do. So thank you for that. Daniel, we only have a few moments left, but I would love to hear more from you about what the changes in crisis services mean to you. And I guess I should mention right now, because we changed screens, that there are 3 scenarios, PDF versions of them in the chat, and they're pictured here so that you can see examples of the services that we provide and how someone may work through or be referred through various services within the mobile response division and beyond. So Daniel, what have all the changes in the crisis response system, what have they meant to you? What do they mean to the community?
Well, I have a lot of optimism for where things will be in the future. Things are starting to get better now. There is a commitment of a lot of additional investment for our community that I think is going to prove to be very helpful. It's still going to be a while before a lot of those things are fully in place. These 3 scenarios on the cards that were put in the chat and are depicted on the screen here give examples of different types of scenarios and what the difference can be. Because on one side of the card is kind of the typical way things transpire with the situation that's being described there, and then on the flip side of the card is the way things can go much better with some of these new investments we've been describing in place. And so we think those will help illustrate the kind of better future that we can have. Ultimately, I see a community where there are just fewer people having these kinds of crises, or when people go into crisis, it's being addressed in a better way, certainly than it's been addressed recently, but even better than the way that it used to be addressed. To some degree, the kind of old way of doing things I described earlier, the kind of relief we would depend on from the involuntary treatment system or from the police, they weren't great to begin with. Those weren't always the best ways that things could be handled. They were just the ways that things were handled. And with the new investments, I think that we will find ourselves in a much better place as a community where situations will be dealt with in the most kind of humane and effective way possible as all of this stuff gets fully put into place. So feeling good about what the future holds.
Thank you. I do want to point out that there was a question in the chat. And Freyton, I believe it was regarding what you were talking about. And Patty asked, do you mean by folks in the community, quote unquote, those who are in homes, possibly with family, who go into crisis? It may have been when you were talking about permanent supportive housing. I'm not positive.
Oh, I see. Yeah. So when we're kind of going back to the mobile response team, the folks that we are serving in those sites are single adults with a mobile response team.
Yep, and they're in DESC or a couple of our partners, permanent supportive housing sites. Patty, let me know if that did not answer your question. We can revisit that. So we'll move on to some of the questions that you all submitted, and there were a lot of great questions that you submitted with the registration form. But before we do that, and in case we run a little bit over our time, I just want to close out here, and then we'll move on to questions. So oftentimes we get asked, how can I help? It seems like such an overwhelming problem, and you do great work, but how can the community help? And so here are a few ways. The first, and I think the biggest, is really if you see someone in crisis or you're not quite sure about it in the community, you have access to this regional crisis line, the 206-461-3222 line. We also mentioned earlier 988, and that is a national response number. Right now, there are a few different kinks being worked out within the county's system, but that is and should be a reliable source in the future. Obviously, I'm the director of fundraising, so I will mention that your unrestricted donations are a major way that we can fill the gap in funding when different contracts don't cover things like occupational therapy services, say, for a client or something like that. Contracts are very prescriptive about how the money can be spent. And so many times, a lot of things that we really need and we pride ourselves in implementing can only be covered through unrestricted donations. So we invite you and we thank you for your support if you already support us. Also, clothing or supply drives, holding those within your communities. We're going into cold weather right now, and we always need sleeping bags and cold weather clothes, and also hygiene products. So there are 3 ways that you can help. You can also volunteer. We are re-expanding our volunteer program post-COVID, and feel free to reach out to me. You should have gotten an email from me today, but it's bball@desc.org if you have questions about that. So let's see, I believe Patty posted again. My point was, does DESC crisis work come to private homes? I see. Sounds like no, only DESC housing. Is Navos involved in any of the new crisis reform efforts, especially since new DESC housing is going up in Burien? Those are several great questions.
DESC's mobile crisis response goes anywhere in King County. So it serves people in private homes, it serves people in supportive housing, it serves people who are homeless on the streets. One component of what Freyton was describing is dedicated specifically to supportive housing and emergency housing in certain facilities that DESC and some other community organizations operate. But the mobile crisis team itself, which currently operates 24/7 across King County, is not restricted to any specific kind of setting. It'll go anywhere. Navos is an organization that does have a big presence in Burien, and they do a whole variety of services for a lot of people. They are part of a network of care that DESC is also part of, and so they're definitely present in part of these conversations. DESC is specifically contracted by King County to do a lot of the crisis response across King County that is somewhat unique to DESC. You're on mute, Brianni.
Forgot about that. I'm wondering if you can expand on the housing levy that's coming up on the ballots that everyone may have on their counters right now.
Yeah, if you are in Seattle, you have the opportunity to vote for a renewal of the Seattle housing levy. This is an indispensable program that funds the creation of affordable housing for lots of different kinds of folks. It is especially useful in creating the kind of permanent supportive housing that DESC and some other organizations create that is aimed specifically at the needs of people with complicated behavioral health conditions, including people who may go into crisis sometimes. So it is really an essential part of making sure there's going to be enough housing for everybody who needs it in the community, including the kinds of folks that DESC focuses on trying to serve. So I encourage everybody to vote for the Seattle housing levy if you're a Seattle voter.
Thanks. Okay, another really great question we got was talking about our overdose response and specifically around how DESC is handling the fentanyl crisis. So Daniel, can you speak, well, and also Frayton too, how is DESC dealing with the epidemic of fentanyl and its effects on the most vulnerable, those without housing and drug use as a coping mechanism to face their bleak reality on the streets?
Yeah, the fentanyl overdose crisis has been quite devastating to us and, to the community at large, of course. There are far more overdose events because fentanyl is so prevalent in the drug supply in the community. Fortunately, there is overdose reversal medication available, and we have focused a lot on making sure that medication is in the hands of our staff and our clients and across all of our settings, so that when an overdose situation occurs, quick action can be taken to reverse that overdose. So that's been a big part of our strategy for addressing the overdose crisis. Unfortunately, there are a lot of fatal overdoses as well. And it's a truly horrendous situation that we're all in at this current moment. DESC is active in a lot of activities trying to prevent and respond to fentanyl overdoses. A lot of that work is around more treatment and better treatment for people with opioid use disorder. We are an active provider of medications for opioid use disorder, and doing more to try to get more people to a place where they will want to utilize those medications to protect themselves against overdose in particular, and also to reduce their use of opioids so that they can have the most successful and happiest lives that they can have. As part of that work to increase our medications for opioid use disorder treatment program, we are actively working on creating an overdose stabilization center where people in the aftermath of an overdose reversal can come to get additional care and support, including medication treatment initiation. That is something that we hope to have up and running at some point next year.
Great. So we have just run overtime, and we have so many wonderful questions here. It would take us another 30 to 40 minutes to answer them all. What we'll do is try and compile some answers to all the questions and send them out to you all. But I want to thank you all for taking time to be with us today and listening to Daniel and Freyton explain just a small amount of our crisis response efforts and how we're moving forward. So please have a wonderful and safe day, and feel free to reach out to me or anyone at DESC if you have any questions. But otherwise, thank you and have a wonderful day.
Thanks a lot, everybody.